So good morning, everyone, and welcome to the National Center for Healthcare Leadership's Coffee Chat. Today's discussion will focus on retention and growth strategies for the workforce of the future. My name is Megan Hussein. I'm the Senior Director of Communications and Development with NCHL. So before we get started on today's discussion, I have a few housekeeping notes. First, if you have any questions or comments for the panelists, feel free to put those in the Q&A section. Well, we're going to try to hold time for questions. Should we not get to them, we'll do our best to address those offline or send them to a particular panelist for follow-up. We are recording this session. It will be available on our YouTube channel for anyone to access within 3 business days. And the recording of this session will also be sent to all registered attendees. Additionally, we're utilizing a Zoom and have enabled the closed captioning. So if you would like to enable your own closed captioning during this event, please click the closed captioning button on the bottom of your Zoom window and we'll get that accessible for you. Finally, at the end of today's session, there will be a very short 3-question evaluation, and we would appreciate your feedback on future educational offerings or coffee chat discussions. And that evaluation link will also be included in the follow-up recording email. So now, without further ado, I'm pleased to introduce today's panelists. Jarvis Racine, Vice President, Strategic Partnerships at Herzing University, Kurt Olson, VP of Talent Management and Organizational Development at Ohio Health, and Sheena Singh, Senior Vice President, National Healthcare Industry Practice at Aon. Thank you all so much for joining us this morning. So during today's discussion, we're hoping to touch on the work you're all doing on pipeline development and diversification strategies, innovative benefits solutions, and stackable credentialing. Each of our panelists bring a unique perspective on strategies to pipeline development and diversification strategies, innovative benefit solutions, and how these stackable credentialing can increase retention and engagement. So to kick us off, my first question is for Kurt. Kurt, I'm hoping you can provide some context for this conversation this morning by considering your position with Ohio Health. And second, if you could highlight for the audience what has shifted in the marketplace staffing from a marketplace staffing perspective and how the related business needs of Ohio Health have evolved.
Thanks, Megan. First off, let me just set some context so kind of how I view the world, if you will. So coming out of this pandemic, for those kind of economic people in the room, we've had supply chain disruptions, supply of labor market disruptions, we've had job market constriction, et cetera. And the net outcome is the classic supply-driven inflationary pressures that end up leading to a recession, which we're all living through right now, right? And that impacts us in healthcare in multiple ways, of course. But the headline, that you don't take nothing else away from this, we've been in recessions before. We're going to figure it out, remain calm. We're going to be okay. So let me kind of jump into Ohio Health and kind of the impacts that all this is having on us. So I look after all of our leadership development programs, all of our learning programs, our clinicals, sim centers, all of our org development work, et cetera. A very fun job. But we're living in such an interesting time right now where we're facing lots of staffing issues at Ohio Health. And, all of us immediately jump to nursing, radiology, lab, all the therapies, et cetera. We're facing similar issues in the corporate space, though, as well, because corporate people are also facing kind of supply chain or supply issues as well. So there's lots of pressures on compensation in the corporate arena as well. So like the world that I live in the talent development HR space, my folks can go work for any other companies. They have to be healthcare, right? So there's lots and lots of pressures on staffing right now. And the net impact is you have the pressures on cost. So our labor costs are going up, and everyone is familiar with traveler costs, be it for nursing or radiology, whatever, right? So you have all these cost pressures going on, which unfortunately starts to impact margins. So there is down margins, your cost goes up as well, right? And we also have supply chain issues we're facing as well, which is further putting pressure on margins. So we're all seeing that. And this is an industry-wide issue. And if you take a look at any of the kind of the healthcare trends, right? A lot of the big health systems struggled to make margin in the last quarter. So we're all facing this, though. We're all in it together. The other fascinating, complicating factor is that it comes on the back end of a pandemic where in general, people's resilience is relatively low at this point in time coming out of the pandemic as well. So you got a really tight labor market with staffing shortages. And then our folks, all the folks on the call today have folks who are clinicians who are also relatively tired coming out of the pandemic because all the pressures of that. And then, of course, the acuity, a lot of our patients has gone up as well. So you have this just amazing, difficult situation right now we're all dealing with where people are tired. We have labor shortages, work shortages, et cetera, where we're struggling to kind of staff our hospitals, et cetera. So ultimately, we all face a basic decision. How do we wrestle with this unique dynamic in healthcare right now and come up with creative solutions to address that? And for us, of course, there's the financial pressures, and that kind of tends to grab people's immediate attention. For us, we have a balanced scorecard. So we're very much taking a look at it from a patient quality perspective, our service, our culture, and then finance, right? Because if you just jump to the finance conclusions, you probably end up having a negative impact on the other three parts of the balanced scorecard. So we're trying to get really creative about how we work, how we address the labor supply issues that we're facing, and come up with some really creative ideas to do that. And Jarvis will talk about kind of how we're approaching it from a higher ed perspective, but we're also from a benefits perspective trying to think through how do we leverage our benefits as a retention strategy for our folks, and also how do we use it as a developmental process for our folks as well. So like we're trying to get creative about tuition reimbursement and almost kind of flip it on its head to say, how can we eliminate the cost to the associates and we can actually work more directly with higher ed to actually pay tuition and not have the out-of-pocket issue you typically have with reimbursement, which allows people that are typically would struggle to take advantage of tuition reimbursement, and we can actually support them better by flipping the model as well. So I don't want to steal any of Jarvis's thunder here, but higher ed plays a super critical role in this process, and we're really leaning on our partners pretty heavily to help us solve these unique challenges we're facing right now. So Megan, that's just some kind of headlines that we're doing in Ohio Health and kind of what we're seeing and how we're approaching it. And I'll throw it back to you.
Thank you so much, Kurt. What a great segue to Jarvis and the creative solutions I'd love to hear more from Jarvis and Herzing University about the higher ed perspective of all of this. And I've heard many organizations, not just Kurt's or Ohio Health, are starting to reach out to higher ed to solve some of these workforce challenges. What does this look like from your perspective, Jarvis? And can you share more about some of the solutions that you're seeing in higher ed?
Yeah, great. Thanks, Megan, and thanks, Kurt, for the nice softballs there. I appreciate it. Yeah, I mean, I think Kurt hit on a lot of the really critical components. I mean, number one, look, the workforce shortage is real. You're all feeling it day in and day out. Higher ed is being asked to be far more nimble and collaborative, which really isn't our history, right? And historically we create the training programs and we send them off to the market and you all deal with them, right? But that's no longer the case today. We can't be that way anymore. So we're really, from day one of working with HR departments, looking at current programming for particular needs, we're right at that table now saying, okay, these are the skills you need. These are the courses that involve those skills. Let's create these kind of really cool course bundles to get you those skills that you need right away so you can deal with those early entrants, right? So really being creative that way. But also Kurt mentioned, the burnout factor and the retention of those employees longer term. So not only are working like that at the front end in those early entrants into the market, we're also being asked to be more creative in stacking credentials and offering shorter term post-baccalaureate type of offerings as well. So we're seeing, how do you take a nurse someone you've identified as a nurse leader down the road, and instead of putting them through a full MSN program right off the bat, you break this out into course bundles over a couple of years and you give them opportunities to grow throughout that time period and address that issue. So a couple of different ways where higher ed is coming in to be more creative on that end, and really more collaborative as part of that process. I think the other thing that we're seeing to support the conversation around dollars is really a big focus now on flipping, as Kurt mentioned, that button of moving away from tuition reimbursement as a philosophy to tuition assistance. And that really is critical as you look through a DE&I lens and you're really trying to provide equity and access, right? And that hindrance of paying for that school ahead of time has been the big reason why people don't get involved in tuition reimbursement programs, right? So we're seeing that big shift up front and utilizing those funds in a much more pointed and specific way to address those issues longer term. So really like the way that's shifting for us, and it really is making a big difference. And we're seeing that really from an educational provider perspective, where we're getting to direct tuition payments from the employer versus running through the student, putting the burden on the student. So it's an interesting shift that's happening, and one that I think really pays well for dividends around equity and access for employees and development along those lines. The other part that I want to talk about as a trend that's happening today is this wonderful circular argument that we've had today with higher education and hospital systems, right? Higher ed's more faculty and clinical spots, and our hospitals say, look, we're burned out, we can't deal with more, we can't take more, right? So you get this argument back and forth, and this circle just keeps going on, and we don't really make progress. Well, we're finally seeing some great breakthrough on this, where we're working with a lot of other hospital systems to talk about how we create more dedicated educational units on those floors, so that we can actually get really 24/7 access to clinical opportunities. And to support that, universities are saying, look, we'll train for scholarshiping amounts. We'll train your nurses to become nurse educators, and they can provide you with more clinical opportunities, so you can direct recruit, and interview those candidates as they're coming forward. So really trying to break that argument and that cycle back and forth around those topics, and really drive through a different way of building out the new future of nurse educators and nursing staff for your hospital system. So a couple of really great trends that we're working on right now, things that we're seeing in the marketplace to address those issues. I would be remiss if I didn't mention one other thing, and that is in the financial side of this thing, seeing more and more shifting to what's called a 50-50 model, or really capitalizing on the deductibility of tuition reimbursement. So really employers at minimum are getting to that 50-50 amount in tuition assistance. We're seeing that go higher for master level programs and other programs as well. But if you're not already doing 50-50, that's really becoming the expectation now to be able to move forward and stay competitive in that space around tuition assistance. So back to Megan, and we can move on from there.
Thanks, Jarvis. If there is time, I'd love to revisit, if you could tell the audience a little bit more about 50-50, because I'm assuming there might be some people in the crowd or later on who have some questions. So I would love to revisit that. But I did want to highlight, so tuition reimbursement is just one of the creative ways organizations are modifying and modernizing their benefit packages, not only for recruitment, but for retention. So I wanted to bring Sheena into this conversation as a representative from AON, because I know AON's doing a variety of creative benefit solutions, having discussions with industry about how to address some of these issues. And I'm hoping, Sheena, you can talk to us a little bit more about how benefit packages are evolving for healthcare organizations right now.
Yeah, absolutely. Thanks, Megan. So I appreciate Kurt sort of setting the stage of all of the factors that are impacting the complexity that's coming with attracting and retaining healthcare talent. And so, of course, there's no magic wand to that, even with the benefits package. But, we are seeing health systems really take a more strategic approach in understanding their workforce and their needs. So there is more of a concerted effort, first and foremost, around deploying employee focus groups and surveys to help shape the reward strategy, really understanding what the workforce is looking for. And that includes the benefits aspect of the total reward strategy. So one thing for sure is that health systems are obviously acknowledging that there's a big diversity of their workforce. And so the benefits that they're offering also has to reflect that. If you can picture, obviously, within the health system environment, you have a physician, a nurse, a manager, an environmental services employee, all on the same work floor. They're going to have different needs from a benefits perspective that not only help them thrive at work, but also help support them outside of work to care for themselves as well as their families. So it's really thinking more more broadly about benefits to support both work and life. And that's what is really important when you think about retention for an employee in the long term. How can we support them throughout the stages of their career within the organization? So we think about that the same way as the multiple generations that are in the workforce as well, in healthcare, and of course with other employers too. But what's important to a recent graduate from nursing school? What are they looking for? An example being they really just want to help, pay off their student loans. So what type of benefits are in place at the health system to support that, and leveraging some of the public service loan forgiveness opportunities that there are that nonprofit health systems can offer to those employees. But then thinking about on the other side, that nurse who's looking to retire in the next few years, but you want them to stay in the workforce as long as they can. So what are the opportunities to adjust the hours that they're working, or looking at job redesign while still continuing to maintain and provide them the benefits that they need to thrive in the workplace and get the basic needs that they have. So it's really kind of thinking about broadly, what do we do throughout the stages of their career, and what the needs are at each level of their of the generations that sit in this workforce. So one concrete example that I've seen some health systems put in place, something called life planning accounts. This is really a shift away from like that traditional, one size fits all benefits approach, but an employee can kind of have a portfolio of options to choose from. What benefits are most important to them? So, thinking about that person who really wants the support around student loan reimbursement, somebody else may really want additional funds to use towards physical well-being, like a gym membership. And another person really needs to have support around long-term disability coverage. So they want to have the funds to help pay for that. So it's thinking about providing those options to employees to meet them where they are. And you can use a life planning account to kind of fund that, that vehicle to provide that support around the diversity of the workforce. And of course, we think about, Kurt mentioned this as well, the workforce resiliency that's so critical. So support around emotional well-being from a benefits perspective is also something that's top of mind for a lot of health systems. And we're really helping them to figure that out from a broader benefit strategy. It's about thinking about the supportive policies that are in place that provide them time off, whether it's to re-energize or to take care of family members because they're caregivers outside of work as well. Or it's thinking about, the traditional employee assistance program only gets you so far. What are we doing to help navigate our employees to the right resources around mental health, to address burnout, to address compassion fatigue, and making sure that we're helping triage those employees to the right level and setting of care. Somebody might need intensive therapy or mental health services. Somebody might just need tools to help reduce stress in very acute moments. So it's really thinking about the bigger picture and ultimately meeting employees where they are. And I think that's really what we think about when we think about innovative benefits. It's really helps supporting the diverse needs of your workforce. And most importantly, communicating the value of that effectively, I think is critical as well to that picture. Hopefully that helps a little bit.
Yeah, absolutely. I hope somebody took something new from that. I sure did. I've never heard of that particular benefit, and what a lovely option. So turning back, I first, I want to acknowledge we have about 10 minutes left. This is always a very quick conversation. So while I go back to Jarvis and maybe if it's okay to ask a little bit more detail about that 5250, I would invite the audience to submit any of their questions that they have. I know we have one that I would like to make sure we prioritize and answer Christine's question about tuition reimbursement policies. But Jarvis, maybe in the same vein, can you tell us a little bit more about the 5250 program? And then Christine's question specifically is tuition reimbursement policies, maybe also a question Kurt can answer. They often include criteria that the employee has to successfully complete the class with a passing grade. What parameters are typically included with the tuition assistance programs? So maybe let's start with the 5250, just a basic, what is it and how can people learn more about it? And then answering Christine's question. Maybe I'm the only person in the room that doesn't know about 5250s, but I hope I'm not.
Yeah, so section 127 of the IRS tax code is where the 5250 comes from, right? So that's the taxable amount that's there. The way that it's kind of showing up on the educational front is that educational institutions are being asked to provide a number of credits in exchange for that 5250 tuition payment, right? So what we're seeing is, we're being asked to do, let's just say, I'll call it 20 credits of learning for that fixed amount of a 5250 reimbursement in that calendar year, right? So the employee gets the ability to select the courses that are based on their program offering of interest to them up to that cap of X amount of credits for that 5250 amount per year, right? So it's just a way of kind of bundling credits in a discounted fashion to give employees access and accessibility to those courses. So philosophically, that's sort of the 5250 plan that's out there. And Kurt, you're gonna flip it over to you to talk more about kind of the structure around tuition assistance programs that you all are seeing and using today.
Yeah, thanks, Jarvis. For the context around kind of policy, you hit on one dimension, which is there a grade requirement? So do you cover a certain percentage based on grades? The other thing you need to wrestle with is, do you have any clawback in place as well? So if someone leaves, do you try to get the money back, et cetera, right? And that whole process as well, right? So is there a commitment to people sticking around after they've gone through the program, et cetera? And those all become, real specific considerations for your particular institution. And for us at Ohio Health, we've decided a couple of things. One, we're not going to put clawbacks in place. So we're not going to put any kind of you need to commit to staying 2 years after you complete the program. We view it very much as a developmental process for our folks, as part of our investments in our folks to develop them. And then secondarily, we've also focused a lot of our attention around areas where we have critical staffing shortages. So we're trying to get the EVS worker to become a nurse, or the food nutrition person to become a radiology. So we're giving people also kind of career guidance around what degrees are going to line up well to actually create a long-term career here at Ohio Health. So, this is not a transaction for us. This is a career pathing process for us. So we're not putting a lot of kind of policy stuff around, you have to get a certain grade, and you have to have a clawback and that kind of stuff. It's more, we're going to help support you on your journey for your career, so we can have this person, in the examples, EVS or food nutrition is not just a job anymore, it's a career. So but that's very much a philosophical approach. You have to sort through at your company, how are you thinking about this? And for us, it's very much a career orientation. So therefore, our policies are aligning around that. So we want people to be really committed to Ohio Health and staying here because of the career opportunities that they have, not around kind of policy constraints and that kind of stuff. So, but again, that's a philosophical question that every single institution needs to kind of ask and answer for themselves.
If I may just add that real quickly from Kurt's perspective, I think what Ohio Health is doing is really cutting edge in terms of that offering. And we're seeing, just as one of their partners, significantly more interest in engaging in the tuition assistance programming than we do with partners who aren't having that same philosophy. So we're seeing an immediate difference in the reaction of employees to that model that's being offered up by Kurt and the team at Ohio Health. So I think it's showing us right away some real evidence that engagement is significantly better when you do it that way.
Thanks, Jarvis. We have a few questions coming in. One is a little bit, we haven't been able to touch on social media and the role that potentially plays in retaining. So I'm not sure if our panelists are positioned to answer that question, but I'm going to pose it anyways and see if there are any kind of comments. An administrative fellow has asked, what role does social media make in an impact on ways to improve the effort of retaining employees? Have you seen any impact, or is it a strategy Ohio Health or any organization, Sheena, you might work with, or at Herzing? Do you utilize social media to help retain employees? And if you do, what ways are you able to comment on?
Sheena, you want to go first, then I'll follow?
Yeah, I can cover that. So, I mean, what we are seeing sort of a re-energizing around the broader marketing and communication strategy that employers have in place about what makes it special to work here. Getting employee testimonials is a great way to do that. We've seen a lot of organizations focus on that, really creating an opportunity for more recognition that our employees can be our champions. And so how can we leverage that outside of our organization and promote that, at the same time do it internally as well? So I think those are the ways in which I've seen it come forth, is really using employees who are dedicated to the organization to be those champions and sort of talk about why they love working at that health system. So Kurt, I'll give it to you if you have any other thoughts there.
Yeah, I think, again, it's probably a philosophical question that every institution needs to ask themselves, right? Kind of how do they want to leverage this channel? Because it basically is a channel that you can tap into, right? So, and like you're saying, Sheena, our marketing communication folks have kind of created channels and Facebook and all those kind of things that we can communicate out to our associates and the broader community. Obviously those kind of things you can create sub communities as well, right? And we kind of leave that up to the individuals, the associates, et cetera. But we do try to create kind of alternative kind of communication channels relative to the kind of the traditional email stuff, et cetera. And obviously today's generation doesn't want to get communicated via email, right? So, I think you have to be in that game. The question is, what is your approach and philosophy around that?
Great, thank you. Somebody asked if Ohio Health or if you know of other companies are asking for a commitment to stay with an organization in exchange for education benefits. And I think, Kurt, you referred to that as kind of the clawback,
Yep.
essentially. And it sounded like Ohio Health has chosen not to go in that direction. Could you highlight, maybe, is there a reason why you have, as an organization, has chosen not to do that, or philosophy? I think you mentioned because you wanted to focus on certain elements of career development, but I don't want to put words in your mouth, so please.
Thanks, Megan. So because we're taking a philosophy around, we're really focusing on our critical staffing challenges.
Mm-hmm.
That then gets us down a career pathing perspective. That we want someone to pursue their degree or their certificate or whatever it happens to be as a mechanism to progress their career here at Ohio Health, right? So we view it very much as a career partnership. There are lots of organizations who put clawbacks in place because that makes sense for their particular organization. So again, it really gets down to philosophy. A lot of people say if we invest in you and you're going to complete your degree or whatever, you have to stay here for 12 months, 24 months, whatever, right? We've chosen not to go down that path, largely because, again, it's a career orientation, but lots of organizations put clawbacks in place. And I'd be curious about Sheena's perspective, but the general guidance that we get from a lot of kind of benefits experts out there is that kind of leading edge companies tend not to put clawbacks in place because they do take the career orientation. But again, that is a philosophical question that each organization needs to kind of ask and answer.
If I may share one additional thought around that topic, and it ties to both Sheena and to Kurt, and that is that we're seeing organizations, instead of put the clawback in, they're utilizing loan buy down programs, as Sheena mentioned earlier, and putting that out over a 4 or 5 year period of time. So in essence, they're creating a clawback without actually having to force the issue contractually, right? So if you stay for a year post-graduation, we'll buy down 20% or 10% and then spread that over that time period. So in essence, it's doing the same thing. It's just shifting that away from a contractual responsibility. Sheena, any additional thoughts on that?
Yeah, absolutely. I mean, that's exactly right. Instead of saying we require you to stay here 3 years to earn this, it's creating those milestones. Year 1, what are you going to get? Year 2, year 3. So you're really creating that engagement throughout their career versus just a one-time thing, and that just keeps them interested in sort of making it to the next level, and then tying those milestones to how they help mentor other employees and sort of help them to engage as well. It's really kind of creating that community.
Yeah, great. Thank you so much, Sheena. I can't believe it, but we are at the bottom of the hour, the 30. In my neck of the woods, it's 8:30 a.m. So we're going to need to wrap up here. But I did want to leave one question. We have another question about whether or not Ohio Health's policy or opportunities are posted anywhere. And I would venture to guess not publicly.
Correct.
Okay. but I think it gives me a great opportunity to segue into some follow-up opportunities for attendees to learn more. So first, I want to really thank you to all of our panelists. Also, thank you to two of our corporate members, Herzing and Aon, for supporting the mission of NCHL just generally throughout the year. Really appreciate that. But to Emmeline's question around essentially where can I learn more? Can I see this policy someplace? We have a couple of great opportunities. So one is our all-member conference, November 14th through 16th in Chicago. It's not just limited to our members. Our program members are the majority of the attendees, but we open it up to anyone who would like to attend. And I know Ohio Health is one of our speakers at the conference this year as well, but that is an opportunity to make connections with people who may be able to share a template policy with you or be able to connect with you. We also have an amazing year-round Leadership Excellence Network program, which is a cohort of healthcare organizations who have these conversations on a monthly basis. So if you're interested in learning more about that, I would invite you to visit our website at nchl.org under the LENS program. And then finally, as we close out, just an invitation to join us in September for our next coffee chat that Ren will be facilitating in partnership with First Group and Newbrick Partners. That registration is open now, and it's on transforming unconscious bias to conscious inclusion. So a little bit different and a pivot in the conversation, but definitely worthwhile. So thank you again, Kurt, Jarvis, Sheena, for joining us, and have a wonderful day, everyone.
Thank you.
Bye.